While we're here, and there's 7 of you, it's very easy to feel like this is the consensus. But when you go on the internet, there's all kinds of people, and on YouTube, and I want to read you something from someone who has her own following, and your response. Nina Teicholz, author of The Big Fat Surprise, Why Butter, Meat, and Cheese Belong in a Healthy Diet, wrote the following. Ronald M. Krauss decided in 2000 to review all the evidence purporting to show that saturated fats cause heart disease. Krauss is director of arterial sclerosis research at Children's Hospital, Oakland Research Institute, and an adjunct professor of nutritional studies at the University of San Francisco at Berkeley. Krauss concluded in 2010, after reviewing all the scientific literature, that saturated fats could not be said to cause heart disease. In March, another group of scientists, including faculty from Cambridge and Harvard, came to the same conclusion after conducting a similar meta-analysis. For instance, the Maasai warriors in Kenya were observed in the 1970s eating nothing but meat, milk, and blood, not a vegetable in sight, yet they were not overweight, their cholesterol levels remained low, even as they aged, and scientists could find no evidence of heart disease, despite conducting electrocardiographs on 400 of them. In India, researchers studied 1 million railway workers and found that those in the north ate 8 to 19% more fat, mainly from dairy products, than their co-workers in the south. Yet the northerners lived an average 12 years longer. This disparity led the study authors to conclude in a 1967 paper that to prevent heart disease, people ought to eat more fermented milk products such as yogurt, sherbet, and butter, half a world away. Scientists observed 80% fat. They should have been in a wretched state, wrote Vladimir Stephenson, the Harvard-trained Canadian anthropologist who lived in the Inuit for years. But to the contrary, they seem to be the healthiest people I ever lived with. The best possible science from the past decade now indicates that too many carbs overall, even of the supposedly healthy whole grain kind, increase the risk of these diseases compared with a diet low in carbohydrates. In other words, too much whole grain cereal for breakfast and whole grain pasta for dinner, with fruit snacks in between, add up to a less healthy diet than one of eggs, sausage, followed by fish. Our dietary guidance has been followed the Ansel Keys view for 50 years now. Despite £500 million spent trying to prove this hypothesis, the evidence of its health benefits have never been produced. Meanwhile, the rates of obesity and diabetes are rising, and heart disease remains a leading cause of death. Your thoughts?
I'd be happy to take that on, although there's about 25 things you mentioned there. I can't be sure that I can remember all of those. But the main points yes, Dr. Krauss is a colleague, and actually some of the very early papers were with our data on small LDL particles. But that particular paper that you mentioned does bring up a very important issue in any kind of study, be it an epidemiologic study or a randomized controlled study, that the comparison always is really important and will affect the results. And in the kind of analysis that most people did actually until not too long ago, if they were looking at something like red meat in the diet, they would look at red meat compared to everything else in the diet. And we already heard, I can't remember who said it, that the average American diet quality is really low, that only about 2.5% have an optimal diet by some criteria. By the dietary guidelines, only 5% of Americans meet the dietary guidelines. We've scored the national diet. It gets about 50 out of 100 score. In our business, that's a pretty low F. So if you're comparing red meat with that rest of the diet and you don't find any difference, it means that red meat's as bad as the rest of the American diet, which is a huge amount of refined starch, sugar, and until recently a lot of trans fat as well. So the real issue is red meat compared to what we would think would be a healthy diet that would be predominantly plant-based protein sources, like nuts, legumes, soy products, et cetera, with lots of fruits and vegetables and whole grain. And when you do that kind of analysis, red meat raises LDL in randomized controlled trials, and also we see very clearly in the epidemiologic studies is related to higher risk of cardiovascular disease. Now, Ron Krauss and also the paper more recently that you mentioned couldn't do that kind of analysis because that was a meta-analysis summarizing published papers, and those published papers had not done that kind of appropriate comparison, looking at a healthy alternative, not just the rest of the junky American diet. And that's a fundamentally important point. I know Colin's made that point earlier on too, that the comparison is critically important, whether it's an observational epidemiologic study or a randomized trial. The comparison determines to a very heavy degree what you'll have as the outcome. So a lot of these other sort of anecdotal comparisons, the Eskimos, for example, Inuits, that in reality we don't really know what their health was. That the best data we have is that they haven't been living very long. But we just simply haven't had good records. Human beings are remarkable. We can survive and reproduce on an incredibly wide range of diets. We are adaptable. Our evolution has equipped us to exist for a while and reproduce on a very wide range of diets. But that doesn't mean that they're going to be optimally healthy if we want to be living to age 70 or 80 with the best function that we possibly can. So I think those kind of anecdotal comparisons maybe get us started. They ask questions. It raises interesting questions about what Inuits have been eating and their health conditions, but it really is, if you want, she's been critical of epidemiologic studies, but she raises the crudest kind of epidemiologic study to try to make a point. Now, she also raised the point about carbohydrates versus fat, and there's now a huge amount of data to say that the percentage of calories in the diet from fat is really not important. All kinds of studies, but the quality of the fat and the quality of the carbohydrate is very important. That plant sources of fat have positive health values, and the quality of the carbohydrate, whole grains, especially intact whole grains, have a very different effect than refined starches do. And in the studies from India, there is a real issue. In most of the diets around the world people are eating, they are consuming too much carbohydrate, probably in general, often 80% of calories from carbohydrate, and increasingly it's refined carbohydrate. So a lot of what would have been consumed by the South Indians there would certainly be very far from what we see as an optimal diet. It would be very unbalanced until very recently, very little fruit and vegetables, and for the most part, what we've called poverty diet, the cheapest thing, which is a lot of carbohydrate and increasingly refined carbohydrate. So we really can't conclude very much from that kind of study.
I was hoping Walter would step up and go first with that. I was tempting to go with, what a shocking load of rubbish. Kind of leave it at that. But Walter did a much better job. But just a couple things to append. In 2020, we no longer have the privilege of talking about diet for human health without considering environmental impact. Even if it were true, and it's not, but even if it were true that your diet could be optimal if you were eating red meat and high intake of saturated fat routinely, if it's going to destroy the planet, frankly, Scarlett, who gives a damn? I don't understand that blind spot in the carnivorous argument. There are no healthy people. There are no healthy people on a ruined, ravaged planet. It's our one shared home. All dietary discussions have to factor that in. So, completely omitted. Walter went over all of the epidemiology, and I completely agree. The one thing that I would append, there's a shibboleth in the mix here. And that's the notion, and you hear it all the time from this particular writer and many others. We've had this dietary advice to cut back on saturated fat for a long time, and yet we're fatter and sicker. Therefore, the advice was wrong. No, we never took it. And besides, there's more than one way to eat badly, and the American public is totally invested in exploring them all. So we never really cut back much on saturated fat, but to whatever little extent we did, we loaded up on Snackwells. We weren't eating more broccoli, rabe, and lentils. And so what we wound up with was a higher intake of total calories, a high intake of refined carbohydrate, and for the most part, an excess of saturated fat relative to recommendations into the bargain. You can't say the advice was wrong if all of the data you have about bad outcomes pertain to people who never followed the advice in the first place. And then in terms of why we never followed the advice, Pam, I think that's in your sweet spot, because the marketing of all the junk food was highly effective, right? When we were fascinated with cutting fat, if all there had been were wholesome, natural foods to do it with, maybe we would have eaten those, but immediately we got Snackwells and low-fat junk food. When we became obsessed with cutting carbs, there was a whole suite of low-carb junk foods. Now you can have gluten-free junk food, and basically you can have any flavor of junk food you want. And that's all marketed very successfully. So we never followed any sensible guidance, and for the most part, we still don't.
I'll add something to that as well. I think that a couple of things worth mentioning. One is that there was a recent study, 2018, I think it was Seidelman's group, that looked at carbohydrate intake and mortality risk. And in fact, those eating the least amount of carbohydrate had a 32% increase in mortality. The folks that had, as a group, the lowest mortality were consuming about 50 to 55% of calories from carbohydrates. And then at the other end of the spectrum, the people eating the most carbohydrates had about a 23% increase in risk. However, the research team said that it was very clear that there was a segment of that group that had higher mortality, that their carbohydrates were coming from refined foods. And of course, you can't remove everything of value to human health from a food, add a bunch of crap to it and expect it to support health. That doesn't happen. But what was really interesting was that the other end of that high carbohydrate group was actually the lowest risk of mortality of all segments of that particular population, and those I would expect were the people that were getting their carbohydrates from foods that were packaged with fiber and phytochemicals and antioxidants and everything else. And that study went another step, and they looked at replacing carbohydrates. If you replaced carbohydrates with animal protein, you increased mortality 18%. But if you replaced carbohydrates with plant protein, you actually reduced mortality by 18%. And that tells us something. And then the second thing I would like to mention is people need to understand sometimes research can take a slant that we might not necessarily recognize based on headlines, butter is back, and so forth. I think one of the best summaries of what we know about the effect of fats on human health, and saturated fat in particular, was the presidential report from 2017. And they concluded what we know: saturated fat increases risk of heart disease. But what's really interesting was, I remember when the 2014 Chowdhury study came out, that concluded that saturated fat has been vindicated, essentially. And those studies that suggested saturated fat has been vindicated, I don't think any of them actually showed saturated fat has been vindicated. Rather, if you replace saturated fat with refined carbohydrates, you're no further ahead. If you replace saturated fat with polyunsaturated fat, you are further ahead. So those are the kinds of things that we learned from these studies. But one of the things I thought was particularly interesting was I realized that one of the authors or co-authors on that study had been a researcher with Epic Oxford. And I asked her, I said, can you explain the findings of this study? Well, she said it's very simple. She said, I had no idea that she was involved in the beginning. And she said in the beginning, when they did this study, we found that there was a 19% increased risk in heart disease with increased intake of saturated fat. I can't remember all of the details, but she said the study was rejected by the journal we submitted it to. So the lead author reworked the data, removing certain things until there was a different result, and the study was accepted. And she said, in no way does that study change anything we know about saturated fat and its impact on heart disease. As far as I'm concerned, and she was one of the co-authors, we still need to be restricting saturated fat.
That's a very interesting story, that the journal basically changed the conclusions. And I heard that from another co-author on the paper, and the other who was not told by the primary author that they had basically changed the data and the conclusion. And it's very curious because it was the same journal and the same editor that just pushed this story about you can eat all the red meat you want to.
Yeah, very interesting.
Yeah, that's disturbing. Great comments by Brenda and raised some good points about the studies. Just one thing, she mentioned a presidential report. That was the American Heart Association president. It wasn't Trump.
Oh, thank you. Yes, exactly.